Taoiseach, last night your government shot down reports that you plan to table fresh pay proposals to the nurses next Monday. In doing so, you bring the country closer to a national pay strike of more than 40,000 nurses, the largest strike organised in this country in quite some time, a strike that Solidarity will support to the hilt. Now, if my constituency of Cork North Central is anything to go by, the nurses enjoy the overwhelming support of the general public. The public believe that nurses are entitled to a pay rise and understand that higher pay for nurses will make for a better health service. Now, last week, you tried to pose yourself as a representative of patients when urging the nurses not to start their strikes on a busy Wednesday. It had no effect, Taoiseach, on public opinion. How hollow your words were when everybody knows your government presides over hospital waiting lists with more than 700,000 people on them. You can recruit support for your stance from the corporate media. You can recruit support for your stance from some trade union leaders who should know better. But you will not recruit support from the general public, because the general public support the nurses, and that support is quite firm, in my opinion. In fact, it is the government who will be the losers if you continue to take a hard line. And if you don't understand this, Taoiseach, then I suggest that you are living in a bubble. Now, one of the reasons working class people support the nurses is because they support what you call knock-on claims. Every worker in the country, public and private sector alike, deserves a decent pay increase. Many struggling with the cost of accommodation and childcare, the working poor struggling just to make ends meet, desperately need one. You will say the country can't afford it, but a financial transaction tax on shares and derivatives would raise more than twice the funding needed to meet the claim. A 2% tax on household wealth over €1 million would raise more than enough to settle other claims. Record private sector profit rates show the affordability of pay increases above the current rates. If the capitalist market can't afford decent pay increases in the fastest growing economy in all of Europe, perhaps working people can't afford the capitalist market. So, Taoiseach, are you prepared to consider a U-turn on nurses' pay before it is too late, before you provoke a major national strike, and apart from anything else, do your own government some serious harm? Thank you.
Thanks. Thank you very much for your question, Deputy. The government acknowledges and is aware of the fact that 2 of the 3 unions that represent nurses have voted for strike. They've done so by a very large margin, 95%, and that indicates the depth of feeling among nurses and midwives about their terms and conditions and pay, and we understand that. And we will engage with the unions, all 3 of the unions that represent the nurses, with a view, and the midwives, with a view to avoiding a strike action if at all possible. There was a meeting between employers and unions yesterday. There will be a meeting of the Public Sector Pay Deal Oversight Committee, I believe, on Friday. So there will be engagement, and we will do all that we can within reason to avoid strike action, simply because of the impact that it will have on patients. And strike obviously occurring midweek will have a very significant impact on patients. It will be necessary to wind down activity, probably from the middle of the day on Tuesday, and things may not get back to normal until sometime on Thursday. So it will result in thousands of operations being cancelled, will result in thousands of patients not getting the appointment with the specialist they may have been waiting to see for a very long time. And that, of course, is something that we very much want to avoid. And even if it is cancelled at the last moment, as sometimes, not always, but as sometimes these strikes are, it'll be too late to reschedule all of that again. And that's why we will engage through the normal mechanisms between now and then to try to avoid strike action. I think it's important as well to point out once again that we have a pay deal, not just with nurses and midwives. We have a pay deal agreed with all public servants, all 300,000 of our public servants. And that pay deal runs till 2020 and provides for pay increases between now and then. And we want to pay those pay increases because we want to pay our public servants better, because they deserve to be paid better, but we need to do it in such a way that it's affordable and is fair, and recognises what's happening in the wider economy, and also recognise what's happening in the wider political situation, particularly in relation to Brexit. And I note the comments of the Leader of the Opposition about how Brexit may impact on the public finances in the months and years ahead. You said that it is your analysis that this dispute could lead to knock-on claims across the public service, and I think your analysis may well be correct. But that would leave us with a bill of billions of euros, certainly hundreds of millions, probably billions of euros in pay increases, and that is not something we can afford. And as always the case with populists of the left and right, you present easy answers, simple solutions, a financial transaction tax. A financial transaction tax will just drive financial transactions to other financial centres. It won't bring in the money that you believe it will, and it's disrespectful, I think, to nurses and midwives thinking of going on strike to present easy answers like that you know aren't true.
I note from the Taoiseach's reply that once again he tries to play up the question of inconveniences to patients as a way of making his case against the nurses' strike. And just before coming in here this morning, I had a look at the Trolley Watch figures for this morning. For the third consecutive day, they have fallen slightly, but for the third consecutive day, it is over the 500 mark. The Taoiseach and this government have no credibility in trying to pose themselves as champions of patients in the context of this dispute. Similarly, I noticed the fact that the Taoiseach tries to bring in the issue of Brexit in making his case against the nurses' strike. Working people will not be impressed by that in any sense, and the government are not going to get away with using Brexit as a way of standing against the rights of working people. In conclusion, I'd make the point that it's one rule for the people at the top and one rule for ordinary working people on the ground. The top 20 ISEC companies, their bosses, are now paid 33 times on average the staff salaries. Some of these CEOs have wages of more than 5 million. The Taoiseach will shrug his shoulders and say that's market forces. But he ignores what the labour market demands, that nurses be paid. They're paid 20% more in the private sector at the moment. You should pay the going rate, pay the nurses and avoid this strike. And if there is any discomfiture, inconvenience or worse to patients as a result, it will be as a result of the hard line taken by the Taoiseach and his government.
Taoiseach to conclude on this matter.
Deputy, I care deeply and profoundly about patients. I'm a medical doctor by training. I worked in the public health service, never the private health service, for 7 years. I've been a Minister for Health and I'm Leader of Government. So I care very deeply about how strike action may impact on our patients. And I care about patients and how they might be impacted, and I care about taxpayers, whether they're working or whether they're not, because people who don't work pay taxes too. Because any solution, any agreement, any pay deal has to be paid for by taxpayers one way or the other, and any strike will have an impact on patients. In relation to trolleys, I fully accept that there are far too many patients on hospital trolleys, and we'll continue to do all that we can to reduce that. But there is one area in which we have had undeniable progress, and that is reducing waiting times for people who need a hospital operation or a procedure. The numbers waiting more than 12 weeks, and 12 weeks is the target set in the Sauncha Care Plan. The numbers waiting more than 12 weeks is now at a 5-year low. And strike action will impact on that. Operations will be cancelled, and the enormous progress that we've made in reducing waiting times for hospital operations and procedures may be reversed. And I really don't want that to happen. And that's why we will engage with the unions to try to avoid strike action if at all possible.
Thank you, Taoiseach.